World Mental Health Day, celebrated every year on October 10th, aims to raise awareness about mental health. The South African Coronavirus Portal notes that an aspect that has been directly impacted by the COVID-19 pandemic is mental health. And as governments around the world imposed restrictions that kept large amounts of people inside, several psychiatric symptoms and illnesses surfaced as a result of the continued isolation and a lack of social interaction with others. Clinical psychologist Dorothy Malemela says the pandemic has had a major impact on people's mental health. And we are in discussion with her now to get some sense of exactly how severe this has been. A very good morning to you. Thank you so much for joining us this morning. This is something that is often taken for granted, where people are forced into a lockdown and spend very little time interacting with others face to face, and the impact has been quite major. Exactly how severe is it?
Good morning, and the viewers at home. We have seen COVID-19 exacerbating mental illnesses, in that we have seen a lot of people living in uncertainties, people losing their jobs, and people experiencing anxiety and also fear. And we have also seen people being in isolation, of which research also shows us that being isolated has had a major impact on teenagers, because it has also increased the rate of suicide amongst teenage youth.
With this increase and this major change, of course, with the COVID-19 pandemic exacerbating the situation, as you make mention of, what are some of the symptoms of a person who suffers from mental disorders? Are some of them notable enough for people to help?
Some of the symptoms that we see in various people differ from one person to the other. And most of the time we see that people with mental illnesses are actually being affected socially, academically, and also how they do at their workplaces. And most of the time we see that people with a mental illness, they become isolated. They also show symptoms of disinterest in activities, and also disinterest in things that used to be interesting to them. And also some of these symptoms manifest through physical pains without a physiological explanation. Hence, we detect that people suffer. It is a mental illness in that regard.
And what are some of the specifics when it comes to mental illness? And, you know, often the label itself, mental illness, gets people really defensive to say that they're fine and that they're just perhaps going through a lot of stress. What is it that needs to stand out when you perhaps yourself have a patient coming in to tell you how they're feeling, and you then diagnosing what it may be? I mean, it could be as extreme as schizophrenia, but there are other, mental illnesses that people should be aware of.
Most of the time we see these clients coming to consult, but they first start at maybe at a general practitioner or maybe a specialist. They complain of physiological symptoms. And when they come, most of the time, it manifests when it's severe, when we start seeing signs of suicide in these clients, and then we are able to see that this person has a mental illness. And I think what actually sets back people to really consult is the stigma attached to mental illness in our communities. And I feel that as communities and also as residents, we should reduce the stigma attached to mental illness and provide support so that people get necessary treatment as early as possible, before it even gets to a psychotic state or a suicide.
And what are some of the trends that you've observed during the space, more especially?
Please repeat your question.
What are some of the trends that you've noted in terms of more and more patients coming in to see you that, of course, form some sort of linkage to the COVID-19 situation impacting one's mental health?
Most of the people that come to our facilities are people that have recently lost their loved one due to the pandemic, and people that have lost their jobs, and also people that have been living with fear and uncertainty of what is going to happen tomorrow. So when they come, that's when we are able to detect that these people are most of the time, as I've alluded, you see it happening in school context, in work context. That's where we start to see that this person is affected. Like, for instance, you start seeing somebody who has been performing before, or rather who has been working nicely at work, starting to not work very nice. They're starting to be slow, they're isolating, they're not happy, they just show symptoms of sadness most of the time. So we pick it up with sadness. These people, they're not even interested in anything that they do in their life.
You make mention of those kind of symptoms, you know, one going perhaps, you know, becoming more distant as one of the symptoms that you mentioned. But anxiety has become, one would suggest that it, well, is one of the symptoms that would be leading to something more serious. How, in a situation like this, do people learn to deal with their anxieties? What sort of advice do you have? Because we're seeing it from young people, from children as well, who have become more anxious because of all the information around COVID-19 and also being restricted in terms of movement.
Anxiety is normal, but then anxiety starts to become abnormal when it really affects how you're going to function, how you're going to also become fearful of everything that comes in your way. So during this time of COVID-19, what we need to acknowledge is that COVID-19 is here, and also understanding COVID-19 and also the impact it has on our lives. So we need to better understand what is going on in our lives, and also seeking treatment as early as before, and also refraining from social media information that is not research-based, because those are some of the things that makes the situation worse, or rather exacerbate the fear that we have during COVID-19.
And what sort of advice can you give to people who may be trying to perhaps listen to you and assess themselves in terms of making the right moves, where to go to get the kind of help that's needed, as well as perhaps community members being aware of someone within their area dealing with some of these symptoms that you've mentioned?
Okay. Firstly, as communities, or other people, we need to understand that mental health, it's a health issue, and stop with the narrative that we treat mental health as an isolation. So we need to begin from there. When we go for our annual checkups, we should also consider checking our mental health, whether we are able to cope with life stresses, and also we need to also become and educate ourselves with various mental health disorders, especially when we are celebrating Mental Health Day today. We need when we better understand this disorder, we are able to detect early symptoms and get necessary assistance.
And besides COVID-19, there have been people with pre-existing mental illnesses that they have been aware of. And COVID-19 came and really disrupted the system in terms of access to facilities and services for mental, neurological and substance abuse disorders. How then can those people continue to take their treatment and be on a path of recovery?
During this pandemic, we've seen a lot of disruption in our mental health care services that we provide in our communities. With people living in urban areas being able to access mental health care services. So what we came with, we came